On the 2nd of April, whilst this country was worrying about Boris Johnson's health, the Department of Health and Social Care published guidance that Covid-19 positive patients would be moved into care homes. It has already started. I am part of an 8,000 plus dementia support group, and husbands, wives and families of loved ones in care homes across this country who were placed there for their safety are now at an almost definite risk of contracting the virus, as they report that the first positive patients have been moved in. Care homes, as Alex Crawford so eloquently explains in her piece on Sky this morning, are not remotely set up to deal with it. In her words, did you leave them to be ravaged by a deadly virus and do very little to help them? Because that's what's happening right now. There are elderly people, many with Alzheimer's, many with dementia, many frail, in thousands of residential homes up and down Britain, and they are very much at risk. Once Covid-19 seeps into those homes, it's a monumentally difficult job to protect the residents inside. A residential home is not a nursing home. You're not sick, you're just elderly. You just need a bit more support, a little bit more help getting up out of bed in the morning, preparing your meals, getting bathed, going to the bathroom, being helped down the stairs. You may have some dementia, you may not, but you have company every day. There are people always around you, and there are care assistants who will help you brush your hair, scoop the soup up to your mouth and read the newspaper. These care assistants are not medically trained. They are not nurses. But if you are feeling ill, they will call the GP or community nurse to come and check on you. There is always help at hand. It gives you security. It is safety in your old age. You don't worry about break-ins, you don't worry about meals, you don't worry about cleaning. And then there's a worldwide pandemic and your care home is infected. You can't go out, your relatives can't come in, but the virus just sweeps through the home and one by one the residents get sick. But even still, after a lifetime of working and caring for others, the ones you care for most can't come in and say goodbye to you as you get sicker and sicker and you finally breathe your last breath. Families and staff are terrified of this new guidance. This is me speaking now. We are terrified for Mom. These are not care homes for the residents and families, they're just home. This decision is reckless and dangerous at best and will result in mass genocide at worst. Even trained medics are dying from catching this virulent disease in hospitals. There are mega hospitals that are not full. There are empty hotels, alternative spaces that will not kill off our most vulnerable citizens that can be used. In the meantime, the general population, that's you and I, are being kept indoors and at least 2 meters away from other people for fear of spreading the infection or catching it. The police are telling us that we can't go out in our own gardens or sit alone on a park bench or in our own cars. But this government is actively introducing Covid-19 into people's homes against their wishes. If you have ever visited a care home, you will know that the rooms are on landings, like they are in our houses, with bedroom doors only an arm width apart. There has to be an agenda, and I don't think I can bring myself to say what I think it is. No sane person would think that this is a good idea. Please help us get this nightmare stopped as soon as possible. I set up a petition 24 hours ago on the 38 Degrees website, and signatures are coming in thick and fast. Please add yours. I implore you to help. Sign and share the petition. Contact your local MP. Contact your local newspaper. Contact your local radio station. Tell everyone you know and urge them to do the same. We have no time to waste.
Our step-by-step action plan is aiming to slow the spread of the virus so fewer people need hospital treatment at any one time, protecting the NHS's ability to cope. We're also taking unprecedented action to increase NHS capacity by dramatically expanding the numbers of beds, of key staff and life-saving equipment to the front line to give people the care they need when they need it most. In the past week, we've completed the construction of a whole new hospital, the NHS Nightingale Hospital in London, built in 9 days. With 4,000 beds, this is the equivalent of 10 district general hospitals. There will be bumps in the road, and criticisms made, and some of them will be justified. Just in case you didn't know, stay at home, protect the NHS, and save lives, and save lives, and save lives.